Hello everyone, myself K. Upender. Today topic is Glimepiride. Glimepiride is an anti-diabetic drug, and to know about what is diabetes mellitus. Diabetes mellitus is a group of metabolic disorders which is fat, carbohydrates and proteins, and mostly the major classification is type 1 and type 2. And the diagnosis of diabetes is three criteria, and the first is plasma glucose level, second is oral glucose tolerance test, third is plasma glucose level. Major classification of diabetes mellitus, which is oral and parental. We see oral is release insulin and other mechanisms. In release insulin is we have sulfonylureas and meglitinide. In sulfonylureas we have first generation, second generation and third generation. And the classification is based on generations. Third generation is Glimepiride, and the classification is based on mechanism action is long acting, and the first introduced in Glimepiride is 1995, and the Glimepiride was patent in 1979 and approved from 1995, and 2020 it was the 87th most medical prescribed. And the mechanism action, and the sulfonylureas which inhibit the ATP sensitive potassium channels, and the potassium channels cannot go out, resulting in charge in beta cells, and the depolarization starts, and that leads to opening of calcium influx. This calcium influx will stimulate the beta cells and release the insulin. And the pharmacokinetics, and mostly it is observed in oral, and its protein binding is 99.5%. Biotransformation is liver, which is CYP2C9 enzyme, and 60% is elimination in urine, and the half-life is 5 to 8 hours. Dose of the Glimepiride is 1 mg, 2 mg, 4 mg. And the combination drugs is pioglitazone and Glimepiride, Glimepiride plus metformin plus oligobose, and metformin plus Glimepiride. Side effects is mostly hypoglycemia and weight gain. Drug interactions, most NSAIDs are causes drug interaction to Glimepiride and sulfonamides and the chlorophenicol. Contraindications, mostly the diabetes ketoacidosis, severe renal or hepatic impairment, and the pregnancy and lactation. Monitoring parameters, checking of blood glucose levels, renal function test, signs and symptoms of hyperglycemia, and HbA1c level, and the use with cautions. Who patient have glucose 6-PD dehydrogenase deficiency and renal impairment, the patient with hepatic impairment. Patient counseling, take this medication by mouth with breakfast, limit the alcohol. During pregnancy and lactation it is not recommended. Storage below at 30 degrees, protect from light and moisture, keep the medicine out of children. While driving or operating machinery, it will be avoided due to increase of hypoglycemia.